Hello, this is my presentation on racial and ethnic inequality for my contemporary social problems class. So, first, I want to say that as a college student, I personally think it is important to care about education and inequality in the United States. Our society, as we see, it's rapidly changing and are growing, and I wonder what the education system may look 10 to 15 years from now, how inclusive it may be or may not be by then. And we see that with the influence of lawmakers wanting to change the education system and the way it is right now. Education should be an equal opportunity for all, so we all are able to get the same opportunities and work the same jobs, no matter the color of our skin. The obstacles minority children face due to their district are, or where they may live has an impact in their overall education. So, my topic. Healthcare access should be universal as seen in other countries. The healthcare system in the United States is very different from the healthcare system in other countries. Financial burdens of healthcare limit people's ability to improve their lives. Some people work only to pay off their medical bills here in the United States or work to only be able to afford the medicine they need to live. They don't work to pay their rent. They don't work to, make their lives grow in a sense. They just work for the healthcare here in the United States. The school to prison pipeline emerges with fewer opportunities for at-risk students, and this goes hand in hand with housing inequality and the impacts national economic growth by reducing mobility and opportunity. And then from this, the school to prison pipeline emerges with then fewer opportunities for at-risk students. And then in schools in urban areas with higher POC populations receive less funding, and POC are people of color. So let's talk a little bit more about healthcare. Minority males have a higher rate of heart disease compared to females. Cancer and heart disease are top health issues for people of color. So we see that the rate for heart disease is 24.6 compared to the female rate of heart disease and cancer, which is 22.4. Not too far off, but we do see that males are impacted more than females. When it comes to education, 2/3 of minority students are in schools with a majority of the same racial/ethnic background. 1/3 of Black students attend highly segregated schools, which are 90% plus minority enrollment. I saw this firsthand when I went to school in Worcester and then transferred and went to high school in Millbury, where the population was mainly, Caucasians and stuff of that matter. And with that, I suffered a lot of bullying for being a person of color, and it was harder to find the resources that I needed. And for example, I was diagnosed with ADHD my senior year of high school because I was the one who had to go out, look for the diagnosis, do what I needed to do. But so housing, we see that African Americans, which is 13% of the US population, represent 40% of the homeless population. And over 50% of homeless families are families with children who are African American. And that is a big, big issue in the United States. Because why is that most of the homeless population basically more than the US population of African Americans? Yes, there are different numbers, but the percentages are insane. So, when it comes to my research proposal, I would have my funding, so the total funding of $100,000. I would set aside for future research about $30,000, and I would have the remaining of $70,000. And then education, I would allocate $25,000 to expand higher education in schools with minority populations and focus on policies to increase access to quality education for marginalized groups. So I would help kids in schools when it comes to college, finding those better opportunities when it comes to education, and not staying in a place where, because many kids, these schools really don't care, they're just there to get their degree. So, and then when it comes to housing, I would allocate $25,000 to assist those on Section 8 housing waitlists. As we spoke about earlier this semester, the waitlist for Section 8 housing is about 10 years now, and that's pretty crazy. And I would also provide support for covering housing costs for individuals and families in need. And then after that, I would then conduct surveys with residents to track the impact of housing stability on their lives. And then for my ongoing research, I would investigate the long-term effects of policy changes on racial inequality in these specific areas. When it comes to my future research, I would want to expand research on the impact of funding and policy changes. And when it came to education, my budget would be $10,000 for gift cards to incentivize participation. So I would survey teachers and students to compare graduation rates, test scores, and college acceptances. With the MCAS not existing in Massachusetts anymore, this is a little bit difficult because a lot of this testing is or was MCAS, but they still do sort of benchmark testing in elementary schools, so I would kind of go based off that or SAT scores. But then I would compare current data with previous year's performance. And then when it came to housing, I would compare living costs for individuals with covered housing versus those without. Assess the impact of housing cost coverage on living expenses. And then my final goal would be to evaluate the multi-sector impacts of racial and ethnic inequality. Any questions? Even though you can't answer right now, Trinidad, I'm sorry. Yay! Have a good semester.